Well, joining me now for her take is Isabel Oakeshott, who's the author of Life Support, The State of the NHS in an Age of Pandemics. Isabel, welcome to the programme. Good to see you. You've said that the NHS can't provide the quality of care that all patients deserve and that it needs radical reform. So what does this radical reform look like?
Well, it was really interesting to hear that previous contribution and the ideas that the panelists there described as a relatively quick fix. Unfortunately, politically, any of what he's just suggested there, for example, the quite sensible idea of a modest charge for missing appointments, or perhaps even a modest charge for a GP appointment, that would be very, very politically divisive, but not a fraction as divisive as it would be to suggest a complete change to the funding system. The reality is that this debate is very artificially polarized. You know, the left, politically, the left have a long history of saber rattling about privatization and continually tend to reference America as the only sort of alternative to the system that we have. Of course, American healthcare is fully privatized. But in actual fact, the vast majority of our European comparator countries have a system that is based on either complete an insurance model, a completely insurance-based model, or some kind of hybrid. And they tend to get better outcomes than ours. So really this comes down to, are we so wedded as a nation to a system that is free at the point of use in the way that ours currently is, that we're actually prepared to put up with increasingly poor care, longer and longer waiting lists, and worse outcomes? Ironically, the answer to that may be yes. When you look at polling on this, for example, the polling that Lord Ashcroft did for the book that we wrote together, a lot of people actually said that they would quite happily put up with worse outcomes for the sake of keeping the current system. They just like the principle.
Sorry to jump in. I wanted to pick you up on the idea of it being politically divisive. I mean, the NHS really has always been politically contentious with its sort of status as a national icon, some calling defence of it an almost religious kind of defence. Why is it so difficult to have a meaningful debate about what we should be doing with our National Health Service?
Well, it's a great pity, isn't it? And it's partly because, I mean, I've got to blame politicians for this, but also some of us in the media for essentially trying to exploit the debate to such a point that people lose track of any kind of reality. For example, on NHS spending, are we at record high or are we spending less? You know, all of this is mired in deliberate confusion. You only have to look at the last Conservative election manifesto pledge in which they promised to build 40 new hospitals. An example of the spin that is applied to this on both sides. It's not just the left, the right is just as bad. They had no plan whatsoever in reality to create 40 new hospitals. No budget had been agreed by the Treasury, and not even a fraction of those number of hospitals has ever happened.
Well, moving away from politics for just a moment, looking at the private inpatient admissions last year, there were more in 2022 than any year since records began. Are we at the point where the public is just beginning to lose faith in the NHS?
Well, that's a really important point, because the founding principles of the NHS were that anybody, no matter whether they were rich or poor, what their background was, they should have equal access to the same standards of care. Now, that hasn't happened for a long time, not because of people's income, but because there are huge disparities between the quality of care and what's on offer in one geographic area to another. But what we're now seeing is so many people who can ill afford it using their savings, their life savings, in order to access the treatment they need in a timely fashion. So essentially, we already now have a growing two-tier system whereby people are having to dip into their own money, perhaps they're having to sell things, whatever it takes, because waiting lists have become so catastrophic. You know, there are tens of thousands of people who have waited over 18 months for treatment. That isn't any kind of healthcare system that should be on offer in a country as wealthy as Britain.